depression. Did you know that you could have depression and still be able to appear happy and vivacious? You can still get out of bed and carry on with your day to day activities of life as you typically do. You may not have crying spells or feelings of helplessness or hopelessness. You may not have self defeating thoughts or self defeating talk. And you may not experience suicidal thoughts or show any visible signs of depression. With high functioning depression, one tends to feel stressed, tired, and overwhelmed. You may also experience mental or physical fatigue or both. And it is often difficult to recognize because the person doesn't exhibit the classic symptoms of depression. It is difficult for others to recognize and difficult for the individual to recognize and even admit. In fact, for some individuals, they may be shocked, upset, or offended by the mention of depression. Not only is there an absence of the common symptoms of depression, but the person may also have a negative connotation of depression, such as believing depression equals weakness, an inability to deal with one's problems, and that they're not strong enough, resilient enough, capable, or competent enough to handle their life stressors. Therefore, they tend to equate depression with a character flaw or deficit. And many are ashamed to seek help, ashamed of the diagnosis of depression if they do seek help, and ashamed and embarrassed by the treatment, including attending counseling or therapy and or taking prescribed medications. A person doesn't want to be labeled, stigmatized, or discriminated against on their jobs, in their families, at school, or in the community. High functioning depression often looks like smiling through pain, staying active and busy, and not out of preference or necessity or responsibility, but primarily as a means of coping. In fact, high functioning depression is characterized by covering and not actually coping. The person tends to internalize, minimize, and dismiss their own stress, problems, or symptoms. They typically don't want to talk about it and may even use humor or over investing in other people to deflect. In fact, if they do talk about it, the person may describe it as being anything but depression. A person with high functioning depression may feel like they're behind in life, dissatisfied, unfulfilled, and may also feel like they're in overdrive, constantly grinding and surviving, but not thriving. And again, this is often difficult to admit. Oftentimes, the person doesn't want to feel like they're complaining. Sometimes the person with high functioning depression will exhibit addictive behaviors, which can include abuse of alcohol or drugs. But they can also exhibit what is known as compensatory behaviors. And these are behaviors that compensate or make up for the person's perceived lack of something, such as perceived inadequacy or perceived failure. Compensatory behaviors can also include overworking, constantly grinding, overachieving, overcompensating, people pleasing, and striving for perfection. These traits can also represent what is known as high functioning anxiety. In addition to this, the person with high functioning depression may either be socially withdrawn and isolative outside of work and necessary activities, or they may seek constant social engagement. This could go either way. For some, social engagement serves as an outlet and a way to distract from their own negative thoughts, overthinking, and stress. It may be difficult for them to be alone with their own thoughts. And for others with high functioning depression, time alone allows them to decompress. They can take off the exterior that they show the world, and they may feel more comfortable because they don't feel the pressure or obligation to perform or meet everyone's expectations of them. And I want to emphasize that high functioning depression is not about being purposefully hiding anything, or being deceitful or manipulative. Instead, it represents habits, behaviors, and symptoms used as coping and survival mechanism. And although it allows the person to function, it is not healthy. These issues tend to build, and eventually the person will experience either physical, mental, emotional, interpersonal, or other forms of distress. So remember, knowledge is power. Educate and equip yourself with the right tools so that you can get the help you need.